the uterine disorders, one of the commonest questions asked in the exam is pertaining to endometriosis, which is going to be responsible for the presence of chocolate cysts in the ovary. Endometriosis is going to be the presence of the endometrial tissue outside the ovary, so outside the uterus, and the commonest side outside the uterus happens to be the ovary, right? We are going to be talking about endometrial carcinoma, which can be associated with a gene like the PTEN gene, and this is going to be having a clinical presentation in the form of development of an irregular bleeding. Two variants that we have for endometrial carcinoma, the type 1 variant and the type 2 variant. Of course, you're aware, the type 2 variant is what is going to be seen in still elderly individuals associated with atrophy, and it is going to be having the presence of a patient having a thin build. Patients who are going to be in the age group of around 60, 55 to 65, they would be having the presence of too much of an estrogen exposure. For example, hypertension, obesity, diabetes are the ones which are going to be having the presence of a type 1 cancer. So type 1 cancer is associated with hyperplasia associated endometrial carcinoma, and type 2 is the one which is going to be associated with atrophy associated endometrial carcinoma. The moment we're thinking in terms of a tumor that is going to be given the name of a fibroid, that is called as Leiomyoma. Leiomyoma is going to be associated with an example of a tumor, again because of the relative increase in estrogen, and the tumor is going to be having too many smooth muscles over here, so that is going to be responsible for giving the presence of a whorled appearance. So microscopically as well as grossly, you're going to be having the presence of a whorled appearance. That is what is to be remembered. Of course, it can be progressing into a complication where the patients can be having the presence of red degeneration. They could be having the presence of a hyaline degeneration. They can even be having a development of a subsequent, very minimal but definitely risk of development of a malignancy as well. So far as a clinical question is concerned pertaining to red degeneration, it will make a mention of the fact that red degeneration is going to be associated with a pro-inflammatory kind of a condition. So patients are going to be having the presence of fever. They would be having the presence of an leukocytosis, and they would be having the presence of an increase in ESR. That's what you need to remember over here with respect to leiomyoma.